Oftentimes, women use their OBGYN for their primary care needs, like managing diabetes, high blood pressure, and heart disease. And these doctors also make sure expectant mothers are healthy throughout pregnancy. But now in Louisiana, that doctor-patient relationship is much harder to find. Meg Ferris explains in tonight's special report.
Baby Farah Tejan is just 2 days old here. When Caitlin went into labor, she and Dad Clay had a 20-minute trip from their home in Franklinton to the OB floor at Our Lady of the Angels Health in Bogalusa.
And it was a vaginal delivery, no complications, no problems.
Doctors there also do her regular screenings and exams.
Oh, I know, we're almost done. If it wasn't for the Angels, I would have to travel at least 45 minutes to an hour to go and do those kind of things.
And with 2 girls now and both working full-time, the opening of the hospital 10 years ago means they can schedule time for health.
When I was in high school, I used to travel at least 45 minutes to an hour to go and get a yearly checkup. And sometimes I would put that off as well.
Safe birth outcomes is the foundation of our community, right? Our families, our children, maternal child health is the foundation of our family.
OBGYN Dr. Robert Maupin, head of maternal fetal medicine at LSU Health in New Orleans, calls what's happening in Louisiana alarming.
In terms of maternity deserts, unfortunately, we are ahead of the national average.
1/3 of the parishes have no or little maternity care. 17 parishes are without an OBGYN. Another 26% have limited access. Many are in the more rural areas, but metro area women are limited too.
Look at Chalmette, so St. Bernard Parish, and in Orleans Parish, New Orleans East. Ever since Katrina, when they lost Methodist Hospital, at present we don't have an obstetric unit that's in the East.
So why is this happening? There are many reasons. More doctors are going to big medical centers where they can join a group practice.
Most OBs are mothers, and we want to see our kids, right? We don't want to be on call 24/7, 365 up all night, the old kind of country doctor. And so it's hard to recruit to rural areas. We spend 4 years learning to be surgeons. It's a challenging training. It's one of the hardest ones out there.
Big centers can help with administrative burdens, dealing with insurance denials and electronic medical records.
We have to spend countless hours trying to do that. And the patient wants the medication. We feel it's best for them, but we have another party saying, you really shouldn't have this, that it takes perhaps sometimes 3 hours to discharge a patient. So in the meantime, you have other patients waiting.
Then there's simple math for earning a living. Insurance reimbursement for this specialty is low, but medical malpractice insurance is one of the highest, while dealing with numerous lawsuits.
Which happens on a regular basis. It increases your insurance even if you're found innocent, and it causes enormous stress and burnout and difficulty being able to even function.
Former State Secretary of Health, OBGYN Dr. Rebecca Gee, says for doctors who want to offer abortions to women, Louisiana's stricter laws are a disincentive to move here.
It's particularly if we want to recruit people here, that these laws are somewhat more reasonable and do take into account medical decision making, especially around the health of the mom.
Louisiana House Republicans have killed 2 bills that would have added rape and incest exceptions to its abortion ban. What do we do?
OBGYN Dr. Leonard Weather, who's on the State Board of Medical Examiners, says doctors should not fear current laws will cause them to be prosecuted for medically necessary procedures.
Once they look at the Louisiana legislation, then they can clearly see and understand it, then they can, provide the services to our patients. They could come here without the fear or threats of losing your license.
What all these specialists do fear is that women and babies' health will suffer if there's not better access to annual pap smears, mammograms, family planning, and deliveries.
We expect for these things to go up because it's clear. Prevention and wellness is enormously important.
ER physician Dr. Joe Blackston has seen the consequences of the OBGYN shortage in Mississippi. Do you see more in the ER, people coming in with complications because they haven't had prenatal care or haven't gone for well woman visits?
Yeah, unfortunately, that's not uncommon at all. Sometimes just showing up in the emergency room not knowing that they are pregnant and birth is sometimes imminent.
LSU Health is working on solutions. There's a new doctorate-level training program for nurse midwives, complete with a state-of-the-art animation lab where mannequins talk and give birth, baby and placenta. There are also medical school tuition waivers for doctors who agree to work in shortage areas for 5 years. Telehealth will play a role, and so will remote home monitoring of pregnant women's vitals. In Dr. Gee's practice called Nest Health, she's delivering health care to families in their homes.
We have a high incidence of untreated maternal depression, and in fact here in New Orleans, some of the data that we've seen at Nest is that only 15% of women of color are even going to their postpartum visit. So it's a real problem.
And Dr. Maupin is helping in a personal way.
I'm very proud that my daughter, who will graduate this coming spring, is going into OBGYN. And so this is the future. This is the future.
We're always going to need an OBGYN. That is it's a fabulous profession. It's the best one in healthcare. And so, I think we have to think about making sure that we're doing everything we can to support those doctors.
Meg Farris, WWL, Louisiana.
There's a sharp rise in U.S. babies born with a sexually transmitted disease. Nearly 40% are women, and women who got no prenatal care. A shift to more virtual prenatal care and reduced clinic hours also means that women aren't being tested for STDs early in their pregnancy.